I am a very old graduate.
Another very important thing is that it cannot be kind of generic.
Especially at this time, take notes because you will forget what happened. You will forget the patients and the stories.
Good morning, good afternoon, good evening, everyone. This is the USMLE Sarthi team, and today's webinar is going to focus on the upcoming math seasons, and specifically the ERAS CV, the personal statement. What are the things people generally make mistakes on? How to avoid those kind of mistakes in your personal statement and ERAS CV. And what you will hear from is the Sarthi panelists, the Sarthi math students, and those who have gone through this journey and what they have learned and what tips they have in terms of guidance for you from this ERAS, PS, CV, and general tips for the math season. Along with that, I do have my team. You'll see Swati, Sejal, and others on my team. If you have any questions, you can obviously put them in the chat. We will take those questions. If you have questions for the Sarthi team, also put them in the chat, and then we will take them, one by one. But we have a packed agenda, and all the speakers obviously are either math students or are panelists, so they are all full-time working in the US system, so I won't take much of their time. So without further ado, let's get started. And I will have things to say at the end. Maybe we'll show you some samples of the mistakes to avoid in PS and CV. But I first want to give our speakers the opportunity. So first up is Ashwin. So Ashwin, welcome. And why don't you introduce yourself and then, take it away.
So good morning to Pawan, the other panelists and all the attendees. So my name is Ashwin Rajiv Pillai, and I did my medical school from Amrita School of Medicine in Kochi in Kerala, India. And I started my USMLE journey in 2023. That's when I gave my step one. And soon after completion of internship in 2024, within a few months, I gave my step two, came here for rotations and applied for the math cycle. And, with God's grace, things worked out. So I'm happy to be here, and I'm grateful that Pawan brought me here. I think I can give some of my personal experience that I wish I had done better, especially when it comes to personal statement and ERAS CV editing. And I have to say, for both of them, Sarthi was definitely a very crucial part in helping me navigate, these uncertain waters. So coming to the point, I think I'd start off with personal statement. So some things that I'd like to tell you all about what to avoid. I think that's, better than what to include. What to avoid in your personal statement would be generic statements. Like almost everyone is going to have statements. Oh, I want to be a doctor because I like helping people, or medicine is my passion. Well, if you're going to write all these things, you need to have certain experience to back it up. Just your personal statement is your own narrative, right? It's your own story. So any point that any quality of yours that you bring forward in the personal statement should be backed up by some experience, and from that experience, it should look to the reader that, hey, okay, this experience kind of demonstrates that this person has this particular quality. So yeah, I think for me, the first would be to avoid generic statements. Second would be listing CV information again. Well, I do understand, sometimes there might be a minor overlap, but don't try to make your personal statement and your ERAS CV just, a photocopy of each other, just in different formats. So that's another thing I would avoid. Thirdly, anything that's very long, like more than 2 pages, I definitely avoid that, because the programs receive 5,000, 6,000, 7,000 applications, and you want to keep your CV concise, to the point, And I think within one page, I think that's pretty good. And make sure your entire story from beginning to end in your personal statement links up to your future goal. I think that's very important because uh, if they're reading that and they say, okay, like he has a story from where he came and what he or she is coming into, what he or she plans after that, I think that would definitely give us an edge. And from my opinion, the person statement, I feel, yes, a bad person statement can definitely get you filtered out, but I think what we need to focus on is a good person statement that conveys your story, not too generic. And I would highly advise avoiding Chat GPT and any AI software because most of them would be generating similar ones for people using that. And yeah, make sure your grammar is correct, your punctuations are correct. That I think for that part, especially, I think Sarthi came like USMLE Sarthi really came in handy for me. And coming to the ERA CV, now among the ERA CV and person statement, I would give personally, I would give much more weightage to my ERA CV because most of the questions that I were asked were based on my ERA CV. I can hardly remember a few that were from my person statement because most were from my ERA CV. So in your ERA CV, what here is where I'd like to emphasize more. You have 10 experiences and that you can list out, and each experience you need to have like a proper heading on that experience that you did, and try thinking of something that's a little catchy too, especially for your top 3 experiences. Make it look kind of catchy because I feel that definitely will catch the reader's eye. And whatever you write in that, I highly, highly advise never lie on either your CV or your personal statement because programs see thousands of candidates every year and they know a lie when they see one. So please do not lie. And on the same note, the experiences that you have, do write them in a detailed format, step by step what you did. And don't make it look too generic as well. If you have a particular experience of organizing a conference in college, tell about what made you think of organizing that conference. What did you achieve in that conference? How did it help the medical students or faculty who came into that conference? So make sure the details that you give about your experience too are not something like just too generic. Some things that you actually did during that particular event. And second would be if you have like, I would say personally keep most at least 8 out of 10 experiences to be like medicine related. I did have a couple of volunteer experiences which were outside of medicine, but I would highly recommend to keep at least 8 of them related to the field of medicine. And coming to your top 3 experiences, well, if you're someone like me who just came out of internship and applied, I definitely think if from my opinion, your internship should be one of them because you can actually talk in depth on what you did. Especially, I did mine in India, and I think I can speak for those others who did in India that we technically function as PGY1s during our internship year back home. So that's 1 year of rigorous clinical experience that I feel you should put as your top 3. Second would be the rotations that you did because your experiences in the US healthcare system, how it's different from the healthcare system that you've practiced in before. That's a point of difference that's going to be constantly asked. And yes, I would highly recommend that. And the third one, yeah, I think that is up to your like on which one to put because each of us have our own special experiences. But again, the ones that I recommended as special, these are just my personal opinion because I felt they were good for me. And yeah, I think these are some of the points I wanted to cover when it came to both ERA CV and personal statement. So I know these are like pretty tense times, but I feel we've all made it this far, and hence ahead like a good personal statement, a very good ERA CV. I think you all be confident in yourselves and believe in yourselves. So yeah, all the best to all of you applying this year.
So, Ashwin, any parting tips overall for the match season? Anything outside of PS and CV what you observed, what you learned. Any tips for people going into the match this season?
Well, for me, I feel a positive feedback that I got in most of my interviews was my overall. I think how I did the interview. Many of the programs really did like it, and I thank Sarthi for that. Like, I feel the interview coaching really did help, especially on the fact that when you go in for an interview, be confident in yourself. Whatever you talk about, you've done it. So be completely believe in yourself. Talk about those experiences. Talk in a confident tone, and I would say always try. Like, I know that we would be tense during interviews, but try to maintain a positive stance as much as possible, because programs too, from their point of view, they interview many candidates almost every single day, beginning October, the second week. So try maintaining that positive phase, because though it might be tensing for us, like any one of us, when we see someone, a little happy, I mean, it does lighten the overall mood. And yeah, I think bottom line, something I want to remind everyone, do not lie. Like, I think telling the truth is the most important part. And because if you lie, you will get caught. And yeah, just do not lie. That's my main point to everyone. Do not lie.
Okay. Well, thank you very much, Ashwin. Appreciate it, and of course, congratulations on the match again, and good luck.
Thank you so much.
All right. Before we move on, a couple of things. I will take questions as they come up, but also I'm aware of the time that other panelists will take. So can we write each US observership we did as a separate experience? So as you probably know that you are limited to 10 experiences in your ERAS CV. So it depends on your profile. It depends on how much work you may have done. You worked in your home country, you did research, all of that. That will determine how many experiences you put in ERAS, how many you combine, and all that. And all of this, we will probably have another webinar, but we also, go over your ERAS CV PS as part of our, the analysis. So Swati can put the link to the new plan that we have, which is called the Turbo Plan. And you can see how our panelists will sit down one-on-one with you over Zoom, and they will help you write these experiences. Then it also goes to the journalists. So the entire thing we cover as part of our classes also. So Swati, if you can just put the link to the Turbo Plan. So I'll take more questions. But I think Parish, you have to leave. So I'll give to you and then Nikita. So Parish, why don't you introduce yourself and then we can take it from there, because you come with a very different experience with a home country, residency, and also your experience in the ERAS CV and PS and how you were able to manage all that. I think that'll be very good to listen to.
Yeah, thanks, Pawan, for giving me this opportunity. Yeah, as rightly mentioned by Pawan, I had completely different experience. I was like I had done my home country residency, as well as I was practicing there back in home country, and subsequently it happened that I had to move to USA, and the best way was to get in the residency and subsequently do the career over here, right? So I had ample experience as well as research publications, but to put all the things together, it was not an easy task for me, So I was kind of seeking the help, and subsequently the Sarthi came to rescue as rescuing me, and subsequently I got the position. Can I share my slide, Pawan?
Of course.
Yeah, so that, yeah. Oh, wait. Okay. Is, okay.
Yes, we can see it.
Okay, so just kind of,
you can do maybe slide share or something.
No, it's, I already shared the slides, right?
As in,
Okay,
slideshow, sorry. Yes.
Okay, fine.
Yeah.
Right. So just quick, I'll just run through it. Like as everybody understands, like why the CV as well as personal statement becomes extremely important, because as you must be aware by now that it's like highly competent position, and chances you are being selected is not only your scores but how you narrate yourself in personal statement, as well as how comprehensive your ERAS CV is, and what kind of recommendation letter you bring, as well as the US clinical experience. So all these things will kind of make your case very strong, and subsequently your chances being matched. Right. So as I mentioned that your CV as well as personal statement, they are extremely handful before you are actually being interviewed. These particular things can make you a very strong candidate, or in fact, it can rule you out, from the entire match session, right? So it becomes very extremely important. So it has to be kind of very accurate and complete. This I'm just talking about the ERAS CV. So one thing you have to mention that each and every tick is boxes are ticked, right? So you don't have to leave any of the experiences unattended, or any kind of the boxes in the ERAS CVs which include your experience, your research, your volunteer experience, and the scores and everything should be completely kind of it should be kind of thorough. The other thing is that kind of the language is very important. You have to kind of, here it's kind of you are selling yourself, so you have to highlight yourself. Like say for an example, any of the research study you are quoting as your experience, then what was your role? You have to highlight yourself, and how you were the key person that actually make that particular research in reality, right? So what you did, which is like kind of unique, and and how the things can shape from your end. So, and it should be kind of what was the outcome, as well as how impactful that particular research or the experience was. So you have to make the your case strong by highlighting your particular involvement or your role in that particular thing. So you have to avoid kind of overlaying long descriptions about certain experience or research. You have to be very thorough about the grammars and everything that this team Sarthi is going to help you in a great way. I don't have to go in the detail of that. So as like Dr. Pillai has mentioned, you have to be very honest while you are writing your personal statement as well as your CV. You cannot lie anything, otherwise you will be immediately ruled out. And as he also mentioned that it cannot be AI generated or ChatGPT generated. So make out your own way of writing it. So this is what I'm just sharing one of the paragraph of my first PS, which I forwarded to Sarthi, and I was like completely bluffed. It was, you can see it's kind of dreamy, I have a dream, but that does not help. Your dream is, nobody cares about your dream over here. Here, in USA, they want to hear something which is pretty realistic. You cannot kind of give such kind of, greater the obstacle, more glory in overcoming it. Whatever challenges, they are not bothered about how challenging your journey to come in USA. It has to be kind of, the reality based. So my advice in PS that it should be kind of story, start with your dream, which either you or your father have seen, and complete, and then subsequently how you went in the medical school, what make you to choose that particular field of medicine, and particularly, and subsequently you can kind of encounter one or two patient experience, or even the personal life experience. Say for an example, I had a very personal thing that I wanted to match in neurology. I was already a neurologist in India, but because I wanted to match here, my distant cousin brother had brain tumor and subsequently passed away. So I made highlight that point, why I'm more connected now, and why I'm coming over here, because there are some resources like are limited at some particular part of the world, and probably that helped me, right? So giving some small personal or life experience is also helpful. And then subsequently, why you are interested in this particular field and what are the evidences that you have worked upon in, and ultimately what's your lifetime goal and how you are going to kind of overcome that dream either you or your family member saw. So you have to complete that cycle. So that's how the personal statement should be, and it should not be kind of dreamy or out of blue or something like that. So I think I have already gone through this. So what program wants to see in PS, that I already covered why you want to come in the medicine, why particular this specialty. So you have to involve either the story of the patient or your own life experiences or the difficulties you go. So for example, somebody would choose surgery because their mother or the father had cancer and subsequently they had to undergo operation or something like that, and that shaked him up and chose to become that particular specialist person, right? So also kind of incorporate US clinical and life experiences ties in that I already discussed. One thing is very important, very unique. It has to be the story which came from within you, and then some people like USLME, the Sarthi people, they will actually kind of guide about your own personal story. They cannot change the entire PS because it's your story, it's very unique. So try to maintain that story, and subsequently you can make little bit changes and grammatical changes and shaping the sentences here and there. That can be done. Another very important thing is that it cannot be kind of generic, like the ideally, say for an example, if you are applying in 50 programs, then you go in the web page of that 50 programs, find out what is there. The first program is home page and the aims and mission statement. That is very important. Go read that, or you can go into the department, say for an example, Department of Neurology, and then the first paragraph would be by the head of the department, what are their visions, and try to kind of write something in your PS that can reflect that, okay, you are a good fit candidate to match all these visions in that particular program. That is why you are also a good fit to that program, and that program also aligns with your own dream, right? So that can be very helpful, but it is a tedious job. I understand if you are applying in 100 programs, then you have to sit for maybe at least 100 hours, in making that program specific PS. But believe in me, that is going to pay off sooner than later, right? So if you are giving the generic PS to all the programs, then they will catch, hey, I mean, our program does not want this thing or this kind of candidate, right? So our vision is completely different, right? So that is one of the way of your rejection, right? So you have to be kind of very specific or in align with the program's demands. The structure and language, I think that everybody knows that the PS has to have 4 to 5 paragraph, 600 to 750 words. It has to be kind of circle back, start from the dream, and I think Sarthi is going to help you in proofreading as well as give you the feedbacks and everything. So it should be very complete, and it has to be verified before you submit it. Again, I'm saying that it has to be very unique, heartfelt, and relevant to the program. It has to be kind of, it cannot be, if you are applying in, say for an example, internal medicine and neurology, then it has to be a 2 different personal statement. It cannot be a single statement. You are applying in multiple programs. So these are the things I wanted to highlight, Pawan.
Well, thank you very much. I appreciate it. Very, very specific, and I think it shows the hard work you put in. In terms of any other tips for the math season, is there anything that you'd like to highlight, whether it's interviews or anything outside of PS and CV?
You are asking me, Pawan? I'm so sorry.
Yes. I'm asking you. Before I let you go, any other, in general, any tip for students going into the math this season? Neurology is anyway very competitive nowadays.
Yeah, I know. So one thing is like you have to believe in yourself. Like everybody matches, why don't you? You can do it if everybody can do it, right? So believe in yourself, but at the same time, you have to be realistic. My personal advice is you to complete kind of all the steps, like including step 3 nowadays. That is very important, especially if you are having some kind of red flags, some low score or maybe attempt, or if you are older graduate, then that becomes extremely important, because we have seen, like in our own program, one of the candidates had to go back, with a gap of around 4 months in that tenure of training, because he could not pass, or he could not successfully clear the step 3 exams in timely. So program director or program does not want such kind of candidate who cannot crack the step 3 timely, and so they would definitely prefer. And in my batch, all of our batchmate have cleared step 3 exams before they actually got recruited, right? So step 3 becomes extremely important. Likewise, kind of you have to write down the experience accordingly, and believe in me, like they will have kind of 6 type of experience, like volunteer experience or teaching experience or your clinical rotation or educational experience. So try to incorporate each and every, at least 1 or 2 example of each and every one. I understand that it's like only 10 experiences, but just put 1 experience of volunteering. That is extremely important in America, that you have to kind of be kind of volunteer at some or the other point of time in your career. So likewise, also kind of try to incorporate your teaching experience. Maybe you have just taken 1 lecture or somewhere, or maybe public lecture, or you kind of during an internship you taught a kind of medical student. You ask your, wherever you are posted, say for example, if you are posted in internal medicine internship, then ask your internal medicine program director or senior resident, hey, can you give me 1 lecture so that I can teach your students? Then they will be very they do not have any time to teach, and they are seeking for such kind of students who help them out. They will immediately give you that particular lecture, and that you can incorporate in your CV. So this will become your teaching experience. Like little you have to kind of as I said, that you have to kind of tick all the boxes in your CV, and it has to be a kind of very comprehensive and complete.
Well, thank you very much, Parish. Appreciate your time as always, and looking forward to having you on one of our next one as well.
Sure, thank you.
Thank you. Before I proceed, a couple of announcements before I give it to Nikita. So there will be more webinars on ERAS CV. So this is not a comprehensive webinar, because I do see questions around geographical preferences and all that. So we'll take a detailed look at how to fill up your ERAS CV in a separate webinar. And by the way, as part of our turbo plan that Swati posted, I think the first 10 enrollments do get a free mock. So take a look at that. And if you have any questions, Swati can answer on the turbo plan as well. This is one of our most affordable value-driven plan, where you get all classes, and now we are also giving out a mock as well. All classes and your ERAS PS CV will be reviewed with a panelist, will be reviewed by journalists, and panelists will have a one-on-one meeting with you over Zoom, program list. So it combines everything, and I think it's a very, very affordable plan as well. So having said that, let me move on to Nikita. So Nikita, welcome, and why don't you introduce yourself, and then your tips for the IMGs.
Hi, everyone. Good morning. My name is Nikita Roshan. I matched into child neurology this past season. And so I was hoping to give you any tips on how to write your personal statement and your ERAS, and the things that I did and things I could have avoided. So I would want to start with personal statement. I would say a lot of us think of this as a creative writing topic, which it is not. And they're not looking for a New York Times bestseller of, like, you're not setting the stage of, oh, it was a cold night and I was the only one in the ICU and there was a thundering storm outside. you just wasted so many words and characters on things that says nothing about you. So focus on real things that have happened to you and have impacted you. For example, I wrote about because for child neurology, I would write things like when I did a rotation, I spoke with a patient who was on the spectrum. She had autism, and how she told me that each letter of the alphabet has its own personality. And so that really got me interested into child neurology and how to deal with such patients. And so just basic everyday things, because not everyone has like, oh, I've been through war and I overcame it. You don't need to have those dramatic stories. You can just say, oh, when I was young, I stayed with my grandma and we were farming and we always ate rice. And then I noticed that most of the women in that community are iron deficient. And so that got me thinking of how I can make a difference, how I learned that, we need to have other sources of iron and spinach. Just those regular, normal, everyday situations, take it and make it extraordinary, or how you use that. And then I also wanted to say, while you are doing your rotations, especially at this time, take notes, because you will forget what happened. You will forget the patients and the stories. And when you're writing your ERAS CV and the PS, it's going to be so helpful if you every day just put the date down, put what you did, put what you learned, anything interesting, and just keep notes every time you do anything. And so that will really help you. You can use it, you may not use it, but you have it there to include in your personal statement. And then the last thing I wanted to say was when you start your personal statement, you could say something about whatever you start with. And then towards the end, you can tie it up to how, this is what I started out with, and this is what my goal is. And so this is how I'm going to achieve this goal with the training I get from your program. And so it helps them remember what your plan is, and it makes it more concise with what they're doing. And then with the generic things like that, grammar is 100%. You cannot have a grammatical error, because if you have one grammatical error, there are thousands of other applicants without that grammatical error. And so that Sarthi really helps you with that. And then just certain nuances to writing in the US is different from, I'm from India, and so we write differently from in the US. And so just having these certain things like having a full stop and then having a space before you start the next word. Those types of things may seem little, but they're very, very important. And once you are in the system and you see things like that, it's very glaring and it shows that you're not prepared. With respect to ERAS CV, again, like everyone else said, make points. And with each of those points, try to give an example. You can say, I love patient care. I am a very good physician, but how do they believe you? Give them an example. For example, again, for child neurology, there was a patient who, there was this little girl who put Play-Doh in her ear. And then she was coming to the asthma clinic for chronic cough. And despite having normal pulmonary function tests, despite all the asthma testing that we did, she had no asthma but the chronic cough. And then finally they realized that there was something in her ear was irritating the superior laryngeal nerve and causing chronic cough. And so that's a very, very niche story, which is specific to child neurology. And only a person who is really interested in that would say something like that. And so if you could incorporate that in just a 1 or 2 liner, so that during your interview, if they are interested, they can bring that up and ask you, and then you have a talking point. And so with everything you write on your ERAS CV, have an example or have some way to show the proof that actually happened, because anyone can say anything. And then even on your ERAS CV, the other thing that a recurrent theme should be about how you worked as a group or how you did things with other people, not I diagnosed this patient just by looking at him. Or you can say things like my co-interns and we had a group of discussing patients, and so we were able to come to this diagnosis. We asked the attending, and then we came to a conclusive diagnosis. It was a group effort, and just having that kind of tone on your ERAS CV shows that you're a team player. So you don't have to specifically write, I am a team player, but including those kind of sentences shows that you are, without really you saying it. That those are all the pointers that I really have. And if you have any questions, I'd be happy to answer them.
Well, let me ask you one question that just came up. So health-related issues. So I think if you look at the chat, so let's say, someone has health-related issues and this particular student was diagnosed with AML, etc. So what is your suggestion? Should these things, the theme, be in the personal statement, or how do you want, or what are your tips if students have health-related issues, how to bring it up, or if to bring it up?
Right. So that makes sense. It depends on how big the health-related issue has an impact on your life and how it affects you. So I know a lot of people have anxiety and depression, and is that really going to make an impact on how you work as a resident? Not really. I don't think so. However, I know a person who has multiple sclerosis and has avascular necrosis of the leg. That is going to impact you as a resident. So that it shouldn't come as a surprise on first day of July 1st, like, oh, this person is in crutches, in a wheelchair. And so those types of things I would definitely incorporate, but also in a non-sob story way. Like, I overcame this because of this. I'm so great and I've been through so many sufferings. Take what you learned from the experience. I had to go down the stairs of these hospitals, but I was in a wheelchair. And so I found a way. How did I overcome this challenge, and how I'm going to use that in residency to overcome? I know that there are going to be challenges in residency. And so I'm going to use my past experiences to help me move forward in residency. And that shows your positive attitude, and how I think the most important thing is having a positive attitude and showing that. Being negative, it really, really shows when you say, oh yeah, it was a rainy day and I had so many patients, and it really shows that you're just not a person who's easy to work with. So just any situation, it is challenging. You don't have to sugarcoat everything, but take the situation, how you overcame it, and how you're going to use that in the future. That's a great way to, put it into perspective, I think.
Last question before I let you go. As part of child neurology preparation, did you do separate rotation in pediatrics neurology, or just an overview of your USCE?
I did separate rotations in adult neurology and in pediatric neurology. I did not have any rotations in pediatrics specifically, because I was more interested in epilepsy. So that can be reached through either path, adult or pediatric. And so I focused a lot on epilepsy.
Okay. Well, thank you. Thank you very much, Nikita. Appreciate your time and very specific tips for the IMGs.
Thanks for having me, Pawan.
Thank you. Let's move on. And we have Dr. Somu Chatterjee next. He's been a very passionate advocate for IMGs. He himself is a very old graduate and now is part of the Sarthi panel. So he, reviews personal statements, CVs, and plus, of course, he brings his own very, very rich experience. So Very good person to listen to for his nuggets. So, Somu, all yours.
Yeah, before I begin, I think Dr. Meza wanted to go. She had some urgent thing.
Okay, that's fine. So, Marita, since you have to go, we'll switch gears a bit. We wanted to talk also about how you are handling the research. So, Sarthi has several research courses. She is part of one of them, the IRR course, and Swati can post a link to that. But Marita, yes, let's talk about where you are in your math journey and how you are using research to improve, enhance your profile, and what exactly are you doing in research.
Morning, everybody. Thank you for inviting me. I am a very old graduate and from Peru, from Lima, Peru, and I went to USA. As a woman, I prioritized, I dedicated to my family, and I left so many years to restart my career. I was the person that was looking so different programs to restart my career and preparing, but this year I decided to do a better choose a course. So I found a Sarthi program. So because I knew that you have to a good CV to do the match. So beside to prepare for the step 1, beside for prepare to the step 2, now you can never do the match without a good CV, including the rotations and research programs. Thanks God, I found the Sarthi program. They gave me a lot, and I was part in the batch in February, and I assist every class. The teachers were very prepared, and now I can see that I learned to do a review and meta-analysis. We're going to do more researches to have a better TV in my to do a better best match. And my advice is trust on you. That's the way you can do this match. Trust on you. Choose a good program, as Sarthi did for me. They guide me a lot, and I am preparing to pass the steps. That's why I am in the very start beginning. And I thank for Mr. Basu that they got our research very good, and we are going to publicate our research very soon this month. And that's why I am very glad to participate in this program. Really, I don't have too much experience. That's why I told you that as a woman, I dedicated to my family. But this program helped me a lot. Now I can say that I can do a meta-analysis research, and we are going to do more research. My advice is don't do much without choose a good program, do a good CV, beside pass step 1, beside step 2, and now you have to pass the step 3. You have to include in your CV researches, not only one. You have to include 2, 3, or 4, depend on the specialty. Some specialty requires more than 5, 7, or 8. And beside that, you have to include rotation, clinical rotation experience. You cannot match without, because it's a lot of competition and a lot of, and more for older graduates. Older graduates has more gaps and competition to compete with other MD as we. So that's why this is my advice, and I learned a lot from the Sarthi program research, and I will continue doing the guidance from the Sarthi because it's a program the program that helped me a lot. Thank you.
Well, thank you. Thank you, Marita. Much appreciate your time and insights into your experience as a student on the Sarthi Research IRR program. So I appreciate your time. Thank you. Before I move on to Somu, let me answer a couple of questions. If I register myself in one of the Sarthi research courses, would it be possible to get 1 or 2 publications before September? So we'll definitely be able to submit it. I think publication obviously takes time. So you can definitely put it as part of your ERAS CV under research. But publication depends on the journal timeline. And Swati can post links to the C2P and IRR, and you can see what topics we are covering in July, August, and September, so that you can decide which research course is a good fit for you in terms of just your focus. So I know the C2P, they are focusing on cancer-related topics for the next 3 months. So for those of you interested in internal medicine, hem-onc, etc., would be a good opportunity. So take a look at that, and we will be able to submit it before the September deadline. All right, let's move on. So, I'd already introduced Somu Chatterjee, Dr. Somu Chatterjee. So, Somu, why don't you, do justice to your own credentials, introduce yourself, and then take it away.
Yeah, thank you, Pavan. And it's always a delight to come here and speak with the aspirants. So a lot of things have already been talked about. So I will kind of highlight some things that I have seen. Give background about me. I am a very old graduate. Had almost 20 years of experience before I actually tried for match. No home residency. Multiple attempts, low scores, very low scores because my scores are really outdated. But otherwise I had a strong CV in the sense of work experience, not really clinical, but a little more academic and in different places. So first thing is, I would advise everyone is to figure out what your strengths are, because your experience, especially for older graduates and people who have some experience, you have to figure out, one thing is, what I like to do in the US, what I want to do, versus one thing is what your CV will be strong in. So have that kind of justification laid out well. But you have like only 3 months to apply for the match. So I hope you would have done this like since last November. So really in US, everything is like 1 year ahead of time. So kind of plan your schedule and timeline likewise. The other thing I would like to highlight is whenever, English is it's a very interesting language, and especially for non-English speakers, we have to be very careful how we use our words and how we use our sentences in communication. That can be personal statement, CV, when you're speaking, reaching out to programs, reaching out to your letter writers, and when you're communicating during your rotations as well. To give you a kind of a brief example, a very short example. So, say, for example, you want to reach out to somebody who's writing a letter for you, right? And is not responded for 4 weeks, and you want to ask them. Basically, you want to ask them that, hurry up and please kind of post everything, but you obviously cannot say that. So instead of saying that, hey, I'm writing this email to remind you, because you are actually reminding him or her, saying that, hey, I want to remind you to upload your letter if you can, please. I'm very thankful. Everything is fine, right? All hunky-dory. But that word that you use, that remind you, that tone is definitely questionable. It's kind of insulting. So instead of reminding, you have to take it in a different context and say, thank you for agreeing to write a letter for me. Is there anything I can help to upload this letter, in the next 2 weeks, right? So you see that there's a difference in tone. Like one, you're saying direct, as you would say in India or many other cultures. Sir, I want to kind of tell you, can you please do this? But telling somebody, reminding somebody, so please pay attention to the words that you use. Okay. The other next point I have is about red flags. I saw some questions about red flags. How do you put it in your CV? How do you put it in your personal statement? So talking about, just carrying on with the theme with the previous speaker, about the tone of your personal statement, of your communication, of your CV, the tone has to be positive. No, you want them to remember you in a positive highlight, okay? Nobody is going to take you because you have a lot of struggles. Because everybody has struggles, and you'll be shocked to hear the kind of stories that American students have here who apply to the programs, right? Compared to that, many of our stories who are able to afford to come to US is not much at all. Okay, so don't think that your struggles are the only struggles and other struggles are, immaterial. So you don't try to dwell on it too much. Okay. What I would definitely, you mention it, but you mention it in a way. So you start with a positive tone in a personal statement, you end with a positive tone, keep everything positive, and have maybe one or two lines just lightly saying that, hey, I suffer from XYZ. I had struggles with this. However, quickly transition to a positive, like how you overcame that challenge and how you achieved something. So this is what we can guide you, because everybody's struggle is different, everybody's profile is different. So I think that is where Sarthi comes in for your one-to-one mentorship, because the tweaking of those things are really important. The other thing about gap, yes, you may have gap for multiple reasons, pregnancy. So some gaps are expected, and you don't have to shy away from that. You don't have to, you can, depending on, you have 8 most, and there's a reason they give you 8 most, right? 8 or 10 most highlights. So one can be a combination of all the researches you've done. One can be volunteers, and then clinical experiences. If you don't have clinical experiences, so if you have clinical experiences, you don't need to put in your gaps as part of the CV. You can, of course, talk about it in your personal statement, saying this is the time when I was self-introspection or whatever, and they appreciate that. There's nothing in the gap as long as you show them how that helped you go to the next step, okay, and how it made you a better person. The other thing I would say is, if you down here, yeah. So as far as the other research is concerned, different specialties have different requirements. Family medicine, so I can speak from family medicine perspective. More interested in QI projects, and QI can be anywhere, right? It can be in your home country. You see there's a problem. You try to solve it. How do you collect data? So again, that one-to-one mentorship definitely helps on figuring out, given your situation where you are working, how to start collecting data and how to do a small QI project, and how can you present it somewhere. All of those definitely options we can guide you. So that is all I have to say. Anything else? Anybody wants to?
No, I think this was very, very comprehensive, and given your experience, I think very useful insights on the subtle changes in language and articulation, how that can make a lot of difference. So I think that was very, very well done. And so thank you very much, Somu. Appreciate your time. And again, for those of you who are interested, if you join one of our plans, your PS and CV will be reviewed, and maybe with Dr. Somu Chatterjee as well. So take a look at that. So thank you, Somu. Appreciate your time.
All right, thank you. Bye, everybody.
Thank you. And now, before I move on and bring in Dr. Lina Cherisan, I do want to answer a couple of questions that have come up in terms of how the PSCV review works and what all do you get in in the turbo plan. I saw a couple of these questions. So let me share my screen. I'll quickly go over it. So here's the, it's on our website. Hopefully you can see the screen. There's a turbo match. This is a new, very affordable plan. What you get out of this is a few things. One, I want to talk about this, what it's a structured approach, ERAS CVPS editing. And it is, you will get one-on-one video meeting on Zoom with our panelists like Dr. Somu Chatterjee and other, and who will walk through your PS and CV line by line, recommend changes and all of that. So that I think is important, that a physician who has experience, who has gone through this journey, is going to take you through all of that. And then, of course, there are journalist reviews. So we have two kinds of review. One is the content review with the physician panelist on our team, which is done on video. And then, of course, journalist reviews it also for storyline, structure, flow, etc. So that is included in the turbo plan. It is included in all the plans. Turbo has all classes, every class that we do. So YouTube is different. All our classes are on Matchflix, and Swati can post the link to some of our class trailers that you can see. So all classes are included in Turbo, including the interview preparation classes. Now, Turbo has digital only access, but other plans you can attend the interview prep live. And then, of course, there is our closed Telegram group that our panelists manage. So any question that you have regarding your application, program, etc., program list, interview, we answer that 24/7. And it's, like I said, it's very cost effective. Some of the other things you get is all classes, all match classes, 50 plus hours. Like I said, the ERAS CV personal statement review by physician over a video call, and then with the journalist, interview questions preparation, all classes, including AI classes, program list. So if you need a list, it's all free, part of our plans. Sarthi community, this is the Telegram group that we support. So that's where the Turbo comes in. And there is a complete description on our website on how we do the ERAS, PS, and CV review. So Swati, can you post this link also? So it'll give you step by step on what it entails. It has interactive classes. So we give you detailed live classes, line by line, how to fill in ERAS CV, what kind of action verbs to use, not to use, both in the ERAS CV personal statement, and then, of course, a professional review, whereas it is the journalist review as well as the review of a physician, like it says, personalized mentoring on a video call. So that is important, you get both perspectives. So take a look at this as you consider Turbo plan or other plans. And of course, all plans come with unlimited meeting times with me as well. So if you have any questions, Swati is there to answer. Now let's move on and bring in Lina Cherisan, our student, and she has had experiences with Sarthi. So Lina, good morning, and I apologize for all the wait that you had to do, but you have a unique story. So why don't you share something about your profile and some tips for the students?
Thank you for allowing me to present my case. My name is Lina Cherisan. I went to medical school first time in Armenia, and went back to my country, did OBGYN. Then I got married in America, and I took USMLE step 1, step 2, step 3, couldn't get into residency, went back to medical school in osteopathic medicine in United States, in New York. But I had some gap between graduation and getting into residency. During that time, I called first time Pawan, I told him, I need your help. He told me, no, I don't have any experience with the osteopathic, no. But I continued to call him and he accepted me, and it was really a good experience for me. From me and I match for family medicine last year. Now I am second year family medicine. The most important things to mention, which everyone already mentioned, and nothing to say anything new, but just to be honest and truthful. Because most of us, we will go and search for doctors, what they did, what they said in their personal statement, and maybe you pick up something you like it, and you say, why don't I say the same thing, and maybe the program director will like it. Don't, because sometimes they will know the truth from your body language, or sometimes if you say something like, for example, for me, I did something it's called Walking on Fire with Anthony Robbins. And if you like the idea about that and you say it to them, they will ask you, for example, he did ask me, the person which I was telling him, he really knew that person. He asked me on more details. Therefore, if you are not experiencing that experiment, don't do it. Don't say anything. For example, sometimes if you say, I did observership in that hospital, but you did not, that doctor, he could have his colleague in that hospital and he might ask about you, and he will tell him, no, I don't know about him. This is to be honest, to be truthful. Second thing, before you go to the interview, if they send you an invitation, read about the people who they are going to interview you. See what they like, what they did in their life, what is their experience. The third thing is that I have very good experience with Sarthi. Everything they told me, I followed. They told me, you do research, I did the research. Go to this rotation, go to that rotation. I followed every step they told me. I did multiple rotations in multiple states during that year. And thankfully, Pawan, he was always receptive to all my questions and my calls. This is the main thing I can share with you. If you have any question, I'm here to answer.
No, thank you. Thank you very much, Lina. And you're very humble, very kind. So glad you had a great experience. And given your extensive work experience in your home country, and especially as OBGYN, you matched in FM. So one common question I have, because there are applicants like you who have done OBGYN in home country and then matching in family medicine. How related are these fields, and how can an OBGYN applicant position themselves for family medicine residency, whether it comes to women's health or some of the other things?
Yes, so you already said, yes. Yes, I think it's not only to do OBGYN, because I have multiple experiences. I did here multiple observership, and I did a medical outreach to another countries in American Latin, and I did the most important thing that, as you mentioned, how I can use my experience in OBGYN in family medicine. As a family medicine, we have rotation in OB, we have rotation in surgeries, we have multiple rotation. And for example, when I go to OBGYN rotation, it's funny that the doctor by themselves, they will ask me to do examination, to go talk to the patient, do multiple things, just to let me put my experience in the real life. And sometimes, for example, they will ask me to give a lecture about my experience in OBGYN, because it's very important that for the woman health to be a little bit have some experience with OBGYN. the other things that we have small courses, for example, especially for student or newly resident who they really didn't have too much experience. How about to examine the woman? How about the anatomy of the GYN? Even one of the experience, for example, I was doing ER rotation, and we had a patient with Bartholin gland infection, and the ER doctor, he asked me to go examine her and give my opinion. The other time we had polyps for the with the on the cervix. They don't do, for example, instead of to call the OBGYN doctor, they just call me. I give them diagnosis. They follow my recommendation, and it was the right diagnosis, and they did the right treatment for her. This is how it helps. Sometimes your experience from other specialty to in family medicine. Yes.
Okay. Well, thank you. Thank you very much. I appreciate your time. I know you're a busy resident, so thank you for helping out IMGs, and I look forward to seeing you again in one of my next webinars.
Thank you so much. Have a wonderful day. Appreciate
Thank you. And I will take questions after all the speakers are done, so you can stay back. But let me take one question before I go to Asma. Yes, Asma, I apologize for the delay, but I will come to you. Let me answer one question on rotations and all of that. So I'm getting a lot of texts on rotations. So yes, we have several rotations for those of you who are going into the match this season. Let me quickly show you where to look for these rotations. So there is a page on our website. If you go, and Swati can post that link. So here you can see all the rotations. And if you click on the Sarthi rotation list as well, if you click on that, you will come to this Google sheet. And maybe Swati, you can post the direct link. And you can basically sort this list any which way. If you click on anything on column B, you will go to the description of that rotation, but otherwise you can see the specialty, state, type of rotation, tele versus hand-on. Hands-on, very important if you are not getting visa. Tele rotations are still there, and there are many students who matched even last season without on-site rotation. So then you can see the setting, the LOR type, if we provide the visa letter, etc. Many rotations are still giving discounts. So you can see if you go down column J and I, you will see the discount amount, the month, all of that. So by specialty, you can sort this list, and many of these rotations are still available. And if you do a rotation even in September, we'll make sure that the LORs are uploaded by September 15th because they take time, So we want to make sure your LORs you get by September 24th. So all the preceptors here will be able to upload LORs by September 15th. So take a look at that list of rotation. It's a very comprehensive list. I think we have more than 300 inpatient, outpatient, tele-rotation, clinic-based, and various price points. We have very affordable ones. We have PD rotations also. So just so that you, have an idea. Okay. With that said, before I take up more questions, let me bring in Asma. Asma, welcome, and thank you very much for your patience. Last but not the least, please introduce yourself and share your insights with the students.
Hi, everybody. Good morning, good afternoon, good night. We are from everywhere. I am here in California, and I joined Sarthi when I did not get matched. I am not matched yet, but I am trying this year too, and I will continue if I don't, because my aim is we have to work on it. How we have to work on it? Like for me, I am an old graduate and have multiple red flags, as Sarthi already told you that if somebody is very perfect, he will match. I am not comparing at all with this. And Sarthi is here to help those people who need help, like have some red flag, need visa, need advice. And even I joined some of the programs, not all of them. I get a lot of advice. I'm thankful to Mr. Kira and all the research team here and whoever helped me, because they advise in a manner that you can, if follow, you will be successful. So even in this program, you get a lot of input, that how you produce your CV, how you produce your personal statement. And if you go with the advisor, I think it will be very positive. One more thing, I am working right now on a research project with Sarthi, the MD research, and also I join one other research that is from Sarthi, good research. So both of them in a different way are helpful. If you do it, there is, I can say the pricing is very good from Sarthi. If you go to other program, you find it very expensive. And if you go for very cheaper version, you will not get a good letter will not very good. And whatever letter I get from here is awesome. Like I can compare and say these letters are very good from the program which I join. So I encourage you guys to join research or clinical rotation if you are not doing with other program. This will help you. And Sarthi has a lot of research. If you really need help, it is very feasible money-wise for me to join anything. If I like to go on clinical rotation, say I want to do tele rotation, right? I am not able to go and do the rotation by myself. Maybe it is in New York. I am living in California, but you can do tele rotation. So even from your India, you can do it. That's my point, that you can save a lot of money instead of wasting it. And you need now clinical rotation and research and more experience, and you learn where you are having deficit. So every student is different, and as a program coordinator, program director, they see in you who are you, what kind of person you are. Everybody is different, so they are not judging everybody in a same manner. And when our application goes to the program, and one of the question I see in the panel that we can write a personal statement for every program. No, we cannot do that. We can only write for internal medicine one personal statement that can go to every program, one for surgery if you are applying to. But my advice is stuck with one or two specialty. Don't go with too many specialty. And Mr. Kira will always advise you in the other sessions, if you follow him, and all the other recordings, if you see them, they are very helpful. And I am thankful to the group that advise like how we can apply to the program. And if you need further help, they are always here. You can always post any question. You can always do WhatsApp. You can always ask a question. They are very helpful. They will always guide you whatever time they have. They try their best, and they don't left you like you are done, your time is over, then you have to leave the Sarthi team. No, they always hear, so they understand you. So my encouragement is that to you guys, that be positive, make a plan, stuck with your own plan. You are different. You are in surgery, somebody is in OBGYN, somebody is maybe in family medicine. Wherever you stand, make your application good and be positive. Hope we all match, and keep your finger crossed. Thank you. Any question you can ask Mr. Kira. He's the best one. And he always help me whenever I need help. I just text him, I just WhatsApp him. If he has time, he said. If he has no, because he is a very busy person, but he always try to help me in a way like this session. He invites me, come and join. And I see so many people who advise me how to create a personal statement. So I get a lot of positive feedback, and I'm thankful for the team that is helping me. And we have a lot of confusion as I am not matched, so I have some deficit. That's why I need something to put up in my CV more and more, like more clinical experience, a few more research. Like I have done 2 of them, but still I am waiting on publication. So we will see. Thank you, Mr. Kira. Anything you like to ask?
No, thank you very much. Appreciate your insights and what you're doing with the IRR project, and also thank you for that, and appreciate it.
Thank you.
Thank you. All right. That was all with the speakers. Now I will take your questions. So, I wanted to show you samples of the before, after PS and CV, but I think we are running short on time. Hopefully, we'll do it in the next one. So, as I talk of the next one, our next webinar is going to be on 27th of July. And we are going to talk about US clinical experience, LORs, and things like that. So if you are interested, we can post a link and then you can join. At least register for now so that, you will get a kind of a message, etc., etc. So here's a link for our next webinar that you can all join. Let me put it to everyone for a minute. So yes, this is our next webinar. This will be again on rotations research, LORs, as we get closer. So take a look at that. So, okay, now let me take some questions. As I take some questions, I have a question. If I apply doing research, how long will it take to publish? Now, as I said, publication takes time. If you are going into the match season now in September, we will definitely submit it. And, publication can take time. And that also reminds me to mention that both the research, whether you do IRR or C2P, so again, both these research will come with a very customized letter of recommendation from the preceptor. So, for example, in C2P, the link that I'm posting, the letter comes from the director of research at Hackensack, Dr. Weissman, right? So, and in IRR, it comes from Dr. Basure. So both of them are very, very accomplished researchers. So they will give you a letter based on your performance in research. So, take a look. It is something to be considered, especially for those of you who are looking for research letter. Is a final year medical thesis relevant experience? So, it's definitely some kind of a research experience, but when they say research, they are looking at what is published in PubMed index journals. Research is part of the research, thesis is part of your maybe PG or something. So it's not considered separately. I think you do need separate publications. Okay. Let me look at something else. Other questions that may have come up. So I'm just looking at other questions. What is an old graduate? So very good question. Different programs have different criteria, and that is also something that you will see as part of the Sarthi list that we make available for free. Most programs will consider you if you are less than 3 years YOG. So for example, if you are applying in September 25, if your YOG is 22 or later, 2022 or later, you are okay. Some programs will say 5 years or less, so 2020 or later. And many programs, most programs will consider anything more than 5 year as older YOG. However, YOG is a very soft filter. As part of our classes, as part of our guidance, we do tell you the tips, the tricks on how to reach out to these programs, how to overcome this kind of a filter. So if you are interested, take a look at our classes that we do, and of course in my meetings one-on-one or meetings with the panelists as part of the platinum plan as well. So Swati can post a link to our classes that you can take a look. The trailers are there, what all we cover in our classes. So take a look. Does USMLE, how to overcome red flags like attempts or low score? So excellent question. It depends on the flag, right? So attempts, low scores, and the specialty. So a lot of it will depend on the specialty. So for example, if you are targeting IM with an attempt, it will need a lot of research and a lot of inpatient rotations. If you're targeting FM, for example, with low scores, then it's more or less the community work you do, the outpatient clinic, community clinics in preventive care. So they will all look for hands-on experiences. It goes without saying, step 3 could be another part. So I'll have to look at the profile before I tell you exactly specific to your profile, what you can do to overcome the red flags. Okay. What other questions did I miss and you had? So, because, during the webinar, I must have missed questions. Is emergency medicine possible when you've already graduated? Absolutely. I mean, we regularly have matches in emergency medicine, visa seeking applicants, by the way. So they do match in emergency medicine. It is very competitive, no doubt. But we have had matches. You will need rotations which give you slowy. You will need good research. It is absolutely possible even by doing externships. Word limits for ERAS CV experiences. So there is a character limit on each of the experiences, and we'll go over that. I mean, you can go into your ERAS and start typing and look at that. But in the next webinar, we will go into that. If you've started it, you will have access to the character limit. I think I saw a question on personal statement. Personal statement, we typically say 750 to 800 words. Does experience having research assistant count as research? So again, I need to see what exactly does a research assistant when you say, because different universities classify it differently. If you have done this as a project manager, just bringing together the researchers, managing the project and all of that, then it is not a research experience. It's a project management experience. When I say research experience, I mean specifically gathering data, analysis of data, publishing the data, maybe getting through IRB approval. So as a researcher, you can do remote research with us, you can do it with somewhere else. But as a research assistant, it depends on what you ended up doing. How long of a duration is considered a gap? So you're right. Sagar is asking, more than 6 months in anything is considered a gap. So whether you took more than 6 months of break in your MBBS or after graduation, I think up to 6 months you are okay. What kind of LOR would you like to recommend for FM residency? I think the question should be what kind of experiences you recommend. See, LOR is a piece of paper. You can get 2 LORs in a month. We have rotations with 3 LORs in 6 weeks. So don't count the LORs. First, look at your year of graduation, look at your profile and see how much experience and what type of LORs you need. Obviously, FM looks a lot for like Lina also said, women's health, preventive care, maybe even a pediatric experience. So it all depends what you have. Inpatient experience is always good. Tele-rotation, I would strongly discourage unless you don't have a visa. If you don't have a visa, tele-rotation is fine. If you are in the country, if you can travel, I think tele-rotation is always secondary to on-site rotation. How many research experiences are needed in pediatrics? We've done a webinar on what averages are in NRMP. So pediatrics, I don't remember offhand, but absolutely 3 to 4 published research abstracts, manuscripts are needed. You should definitely target it if you can. Do you need to have all inpatient rotation? Is it okay if you have one clinic PCP experience? Absolutely. It is okay to have outpatient experiences also. Remember, it's a mix that matters. It is not only inpatient experiences. You know, people match all the time with even outpatient. Outpatient generally tends to be cheaper. It tends to give you more flexibility in terms of EMR access, in terms of patient interaction. So we always recommend a mix, and you can go to our website. You know, I shared that Google sheet. You can go to that website and see what kind of experiences we have that you can do. What else? ICMR funded research experience considered or grant. Oh yeah, ICMR, if as a student in India, you got ICMR funding, one of the best kind of experiences. But of course, that is just one way. You got funded, but what about the outputs? Unless you have been able to publish it, you know, that's only half the story. In externship, to which extent can we write hands-on? Extent is to the extent that you were able to do hands-on, patient interaction, family meeting. See, EMR access everyone can get. You know, EMR access by itself does not mean hands-on. So it is patient interaction, managing the patient, you know, counseling them, counseling families. Extent matters in terms of what the physician or the hospital allows you. It also depends on the state. Some states do not allow hands-on. Would it be possible to have old grad with gap year to match in psychiatry? And you know, this comes from Amy. Absolutely, it is possible. I mean, psychiatry is becoming very hard, but it does not mean that it is not possible. If you have relevant research, they generally look for step 3 and relevant rotations. We got a lot of rotations in psychiatry. You know, obviously, if you don't need visa, becomes easier. Does internship in September or October, is that counted? September, absolutely counted. It will come on your ERAS. We can get you an LOR. October externship counted in the sense that you can send an email, but I don't think the LOR would matter unless you are applying for SOAP. Then, of course, you can upload that LOR. What experiences are needed in pediatrics? Obviously, as the name suggests, a lot of experience with the kids, including volunteering experiences, maybe inpatient, outpatient. The more you do in pediatrics, of course, is helpful. Maybe one rotation in FM is also okay. Okay, so, you know, that was all that I had. We already are over our time, and wanted to thank all of you. Remember, there are plans that we can help you with. For those of you applying to the match this season, the turbo plan that Swati shared or can share now will give you everything you need for the match application, interview preparation, ERAS CV review with the physician, with the journalist, sitting down one-on-one, meetings with me. That's all part of the turbo plan. So take a look at the turbo plan. And I wish I could answer more questions on when the pathway will open. Unfortunately, I am as much in dark as you are. Generally, they used to open in June. Now we are at their mercy. I have no insights into pathways. As soon as they open, they will open. As soon as they open, we'll let you know. I know it's very it creates a lot of apprehension and stress because you are waiting for your ECFMG certification. So it's unfortunate, but I don't know the answer. How does endocrinology rotation help in FM residency match? So endocrine is mostly obviously IM related, but if there are outpatient family medicine, we can always link it. So that is where our panelists can help you frame your CV in how to link different experiences relevant to the specialty. Can we take step 3 until Feb? You can, but it's not going to help you unless you just need a visa. Okay. So H1B, yes, maybe you take it in Feb, and maybe that can help. So with that, I just wanted to thank you all for joining us. This was great. If you join the next webinar, we will have more interaction, and we'll have more on that. Here's a list to the turbo plan. Many of you have been asking, so take a look at the turbo plan. That is something that can help all of you if you're going into the match this season. And like I said, our next webinar is going to be very, very soon. So in 2 weeks, and we can send you a link to attend as well. So let me post that link one last time, so that all of you have it and you can register for it. Let me post that link, if I may. Okay, so here's a link, and you should be able to access this link. If not, we'll send it out. I don't know why you would be blocked from the website. Maybe it is you're joining from somewhere, some countries maybe, but you should be able to sign up for the webinar and look at the turbo match. Otherwise, send us a link and we'll take it from there. Okay. With that, thank you all, and I'll see you next time.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.